Hey everyone, I'd like to share an experience from my clinical rotation in August of 2025 that addresses EPSL 01, using a caring holistic approach to provide and advocate for safe quality care while valuing the dignity and uniqueness of each patient. What's going well? I feel that my confidence in communicating with patients and knowing what to do to advocate for them has improved. I've grown in my ability to balance clinical judgment with empathy and respect for patient autonomy. The situation. During one of my clinical days, I cared for a 23-year-old male whom I'll refer to as Mr. H. He was admitted for an abscess on his right rib cage, just below his axilla. He had a history of IV drug use, but reported that he now only uses marijuana. Mr. H was very agitated and refused several aspects of care, including wound care, because of pain. He was receiving vancomycin and Zosyn for infection and had a large amount of purulent drainage coming from his wound. What happened and the outcome? The situation was challenging because his refusals limited our ability to provide the most effective care. However, by approaching him with empathy and respect for his autonomy, I was able to build some rapport. Instead of insisting, I sat down and acknowledged his frustration by saying, "I can see this is a lot to deal with right now. Can we talk about why you're frustrated and how I can help you get your needs met?" This helped de-escalate his agitation. Eventually, he agreed to allow wound care once his pain was addressed. The provider ordered a one-time dose of morphine, which was given, but ultimately the patient still would not allow wound care to be completed, stating he was still in too much pain. He later left the hospital against medical advice. How I felt. Initially, I was frustrated because I wanted to help him, but his resistance made that difficult. At the same time, I reminded myself that every patient has the right to make their own choices, even if I disagree. Once I shifted my mindset from control to compassion, I felt calmer and more effective as a nurse. Even though he didn't ultimately get the wound care he needed, I know I did my best by presenting him with all his options and allowing him to choose. Sometimes that's all we can do. Why it happened. Making sense of the situation. This situation highlighted the importance of trust and patient autonomy. His substance use history, pain, and frustration with hospitalization all played a role in his behavior. He needed to feel heard, respected, and to have at least a small amount of control over his situation before he could engage in care at all. It also reinforced the importance of pain management and therapeutic communications as part of holistic nursing for me. Could I have done anything differently? Looking back, I could have collaborated earlier with the provider about adjusting his pain management plan to make wound care more tolerable, but his expectations for pain management were likely also not realistically safe. Of course, I would have done this through the staff nurse and my clinical instructor. Earlier communication might have prevented delay in treatment and reduced his agitation sooner, allowing him to get the care he needed. What I'll do differently in the future. In future situations, I'll assess not just the physical needs, but also the emotional and psychosocial barriers to care early on to help foster trust between the patient and I. I plan to continue strengthening my motivational interviewing skills to help patients move toward acceptance of care without feeling pressured or judged. Reinforcement and how this made me a better nurse. This experience reinforced the patient-centered care isn't just about compliance, it's about partnership. Respecting a patient's dignity and autonomy, even when their choices differ from medical advice, promotes trust and better long-term outcomes. I also recognize the value of teamwork. My clinical instructor and staff nurse quietly supported me during this situation by checking on Mr. H later, which validated my approach and reminded me how essential team collaboration is in holistic care. Overall, this experience strengthened my sense of empathy and advocacy. It reminded me that every patient, regardless of background or behavior, deserves care that honors their individuality and choices. Thanks.